The APOLEX Tite procedure can be performed easily in about 2 minutes per treatment area. First, create a small entry point for the cannula using an 18-gauge needle. Once the foot pedal is pressed, the preset radio frequency RF energy is delivered through the cannula. Avoid stroking a single spot repeatedly. It is essential to move the cannula evenly across the entire treatment area. Applying a drop of saline at each entry point can help minimize the risk of thermal burns. The cannula is a disposable item sterilized with ethylene oxide EO gas before shipment. When performing bilateral cheek treatments in combination with Ulthera, the reduction in facial volume becomes significantly more pronounced. A major advantage of APOLEX Tite is that it can be safely combined with other procedures. However, Ulthera should be performed 3 to 4 weeks after APOLEX Tite. If both procedures are carried out on the same day, the energy setting must be reduced accordingly. If the cannula does not glide smoothly, it may help to pre-create a small tunnel using a 20-gauge needle, which prevents damage to the tip and facilitates smoother strokes. During treatment, you will feel localized warmth as the subcutaneous fat is liquefied. The procedure can be performed without a full surgical setup, making it suitable for office-based treatments. Alternate your strokes to gradually melt the fat within the target area. When treating a larger area or when sufficient time is available, extending the treatment will further enhance fat reduction. In combination with Ulthera or Thermage, many practitioners charge an additional 500,000 Korean won per area. Although patients might appear hesitant, in practice most agree to the combined treatment once they see the benefits. As you can see, the strokes are performed with a gentle scraping motion along the skin plane. Avoid inserting the cannula too deeply, as it may irritate facial nerves. By maintaining a superficial subcutaneous plane, the procedure remains safe and prevents nerve injury. The double chin area is treated using the same protocol, usually with a slightly thicker cannula, and the same applies to the abdomen. Even with this single procedure, substantial RF energy is delivered. Performing Ulthera after 3 to 4 weeks provides excellent synergistic results. Aspiration or suction can be performed through an 18-gauge needle as most of the fat has already been liquefied by RF heating. Since the subcutaneous fat has been disrupted, Ulthera treatment can follow immediately, and visible volume reduction can be confirmed by inspection. In patients with a history of facelift surgery, extra caution is required as dimpling may occur. In such cases, filler augmentation can correct the contour irregularity. The procedure is now complete. A reduction in facial volume can be clearly observed, and the treatment is finished simply by applying adhesive strips over the entry points. Some patients may report numbness around the jaw area after the procedure, so it is essential to inform them that local anesthesia was administered. I have previously given lectures on sedation anesthesia. When using Novocaine, I administer 0.4 grams for female patients and 1.0 grams for male patients. When given via intramuscular injection, it provides analgesic effects, allowing for a more stable procedure. I use Novocaine for intravenous injection. Because propofol alone does not provide sufficient analgesia or stability, we also administer atropine additionally. This is because excessive saliva or sputum can obstruct the airway and cause complications. Atropine also blocks parasympathetic stimulation, preventing patient shock during the procedure. It is recommended to use at least half an ampule of atropine. It is much more effective than Rubinol. The marginal mandibular nerve exits in this area. Therefore, the APOLEX Tite procedure should be performed at a superficial subcutaneous level. This patient is relatively young and does not have much subcutaneous fat. However, many female patients visit for this type of procedure as they often dislike the deep buccal fat area. In such cases, APOLEX Tite effectively eliminates the deep buccal fat. When combined with Ulthera or Thermage after 3 to 4 weeks, the effect is significantly enhanced. Thread lifting can be performed immediately after APOLEX Tite. Since the facial volume has already decreased, lifting with threads creates a more dramatic result. By performing the procedure close to the skin surface, there is no risk of injuring the marginal nerve. In my opinion, the best indications for APOLEX Tite are the deep buccal fat and nasolabial fold areas. Tumescent infiltration may cause swelling. However, performing suction, as with the first patient, greatly reduces the swelling. I even performed the procedure on myself and was able to record a broadcast without noticeable swelling. Unlike a needle with a bevel, the APOLEX Tite cannula has no up or down orientation. Therefore, it should be used with the feeling of working just beneath the skin surface. By maintaining a gentle scraping motion along the skin plane, you can avoid contacting the marginal nerve. This approach ensures effective skin tightening. After melting the fat, insert the needle, apply slight negative pressure, and move it back and forth gently. This will extract the liquefied fat. For fat melting, 40 watts was used, and for tightening, 35 watts is sufficient when working along the skin plane. This patient had minimal fat, so mostly blood was aspirated. Even without significant fat, the procedure can still be performed for tightening purposes. We describe this as performing thermage from inside the skin, or inside thermage. The results are clearly effective. After performing the procedure a few times, you will quickly develop a good sense of it. It's a straightforward treatment. After removing the tumescent solution, the jawline becomes noticeably sharper compared to before. Unlike plastic surgery patients, dermatology patients generally have modest expectations. Therefore, even this level of improvement leads to high patient satisfaction. Thank you very much for your attention and effort,